All right, welcome to the Explainer. Today, we are diving into those super common, super annoying health issues we all get. You know, the ones in our eyes, ears, nose, and throat. We're going to pull back the curtain using some great info from Mosby's Pharmacy Technician textbook to figure out what's really going on in there. So, let's just jump right in.
I mean, who hasn't, right? That miserable, itchy-eyed feeling from allergies or that sharp, throbbing pain of an ear infection. Or a throat so raw you can barely swallow. We've all been there. And today, we're finally going to get to the bottom of what's causing all that misery.
So we're not just going to list off symptoms. No, we're going to dig deeper. We're going to uncover the why, like what is actually happening inside your body. And then the how. How do the treatments actually work to make you feel better? The whole point here is to give you some clear, practical knowledge that you can really use. Okay, so first up, the eyes. There are windows to the world, right? But sometimes, man, they feel less like windows and more like screens that have been left open during a full-blown pollen hurricane.
You know exactly the feeling I'm talking about. The itchy, red, watery eyes that just won't stop. That's typically allergic conjunctivitis. And what's key to know is that it's not an infection. It's really just your body's immune system kind of freaking out and overreacting to stuff in the air, like pollen or cat dander.
So how do we fight back against this rebellion? Well, the treatments work in a few really cool ways. First, you've got mast cell stabilizers. Think of these as the bouncers at the door. They're preventative. They stop your allergy cells from even releasing all those nasty inflammatory chemicals. Then you've got your antihistamines and decongestants. These are the cleanup crew. They're for damage control, tackling the symptoms you're already feeling. And if things get really bad, that's when you bring in the corticosteroids. They're the heavy artillery, a super powerful option to just shut that inflammation down.
But wait, not all red eyes are from allergies. If you've got bacterial conjunctivitis, yep, good old pink eye, you're dealing with a whole different beast. The key word here is bacterial, and that means it is super contagious. Seriously, this is why if someone in your house has it, you need to be washing your hands like it's your job.
Okay, let's shift gears now to something much more serious. Glaucoma. The root of the problem here is really high pressure inside the eye, or what doctors call IOP. The best way to picture it is like the air pressure in a tire. If it gets way too high, it starts causing damage. And in your eye, that pressure, if you don't treat it, can actually and tragically lead to blindness. So this is a big deal.
So what's behind this crazy pressure? Well, it all boils down to this fluid in your eye called aqueous humor. See, your eye is constantly making and draining this fluid, kind of like a little plumbing system, to keep the pressure just right. Glaucoma is what happens when that system goes haywire. Either the faucet is stuck on high, making too much fluid, or the drain is clogged and it can't get out properly.
And that perfect analogy leads us right to the two main types of glaucoma. You've got open angle, which is the most common kind. That's a slow drain problem. The pressure builds up really gradually over time. But then there's closed angle glaucoma. That's a blocked drain. It's a sudden, total blockage that causes this intense, sharp pain. And let me be clear, that is a true medical emergency. You have to get help fast.
Okay, here is an awesome pro tip for one of the common glaucoma drugs, latanoprost. The brand name is Xalatan. See the prost at the end of the name? Just think Frosty the Snowman. It's a fantastic little trick to remember that this medicine needs to stay in the fridge before you open it. And get this, for a wild side effect, it can actually make your eyelashes grow longer and darker. How crazy is that?
All right, we've talked sight, now let's talk sound. We're moving from the eyes and diving into the super complex, super sensitive world inside our ears. I mean, the ear is just an amazing piece of natural engineering. It's incredible. We can break down how it works into a simple three-step journey. Step 1, the outside part of your ear, the part you can see, catches the sound waves. Step 2, the middle ear takes over, using these tiny little bones to amplify those sound waves. And finally, step 3, the inner ear does the real magic, converting all those vibrations into nerve signals that your brain can actually understand as sound. Just amazing.
So what happens when that intricate system breaks down? Well, you can get things like otitis media, which is just the fancy term for a middle ear infection. This usually happens when that little tube connecting your ear to your throat, the eustachian tube, gets all swollen and blocked up. And hey, here's a huge tip for all the parents out there. For little kids who can't tell you what's wrong yet, a classic telltale sign of an ear infection is when they just keep pulling and tugging at their ears. And then there's the other really common ear issue, earwax. The technical name is cerumen. Now, earwax is actually a good thing. It's protective. But, sometimes our bodies just make too much of it, or it gets all dry and packed in there.
And when that happens, it can totally block up your ear canal and make everything sound muffled.
So what's the right way to deal with it? Well, for starters, you can soften up the wax with simple household stuff, like a little mineral oil or even olive oil. But the most important thing, and I mean the most important thing, is what you should not do. Do not, I repeat, do not shove a Q-tip deep into your ear. All you're going to do is make it worse by pushing that wax further in and packing it against your eardrum. Just don't do it. Clean the outer part of your ear and let a doctor handle anything deeper.
Okay, so let's connect all the dots now. We're going to move on to the nose and throat because, let's be honest, they're usually part of the problem when our eyes and ears are going haywire.
And now for a very familiar villain, strep throat. You can usually spot this one because of how it hits you. It's the suddenness of it. You feel fine one minute, and the next you have an incredibly painful throat, a fever, and yeah, often you'll see that gross white stuff on your tonsils. And since this is a bacterial infection, you absolutely need antibiotics to knock it out.
And this is why it is so important to actually treat strep throat and not just tough it out. If you leave it alone, that bacteria can actually travel through your bloodstream and set up camp in your heart, causing a really serious infection called endocarditis. It's just a powerful reminder, Sometimes a sore throat is way more than just a sore throat.
Okay, everybody listen up because this is a huge safety warning. If you ever use a nasal rinse, like a neti pot, you can never use water straight from your tap. I know it sounds crazy, but there have been these extremely rare but fatal cases of an amoeba that can be found in tap water. The rule here is simple, and it's not up for debate. You must always use distilled water, sterile water, or water that you've boiled and let cool down completely.
All right, for this last section, let's get really practical. We're going to put everything we've learned together with some super valuable tips for when you're standing in that pharmacy aisle.
All right, look at this number, 28. What on earth could that mean? Well, it's a super simple rule for eye drops that could literally save you from a nasty infection. Here it is. To stop bacteria from growing in the bottle, you have to throw it out 28 days after you open it. Yep, even if there's still stuff left inside. 28 days, that's it.
Okay, lean in for this one, because this might be the single most important thing you learned today. Eye drops can go in ears, but eardrops can never ever go in eyes. Why? Simple. Eye drops are made to be totally sterile, no germs, so they're safe for your ears. But eardrops, they are not sterile. Putting them in your delicate eyes is a huge no-no. So let's say it again. Eye drops in ears, safe. Eardrops in eyes, never. Got it?
Now just look at how scary similar these drug names are. You've got Timoptic, Viroptic, and Tobrex. They all sound almost the same, right? And sometimes their boxes even look alike. Here's the terrifying part. They treat completely different things. One's for glaucoma, one's for viral infection, and the other is for bacterial infection. This is a perfect and kind of scary example of why you have to double-check, no, triple-check your medication labels to be absolutely positive you're using the right stuff.
So there you have it. We've dug into the why behind the problems and the how behind the treatments. We've even shared some insider pro tips. So now, this last question, it's all for you. Now that you're armed with all this new knowledge, what is the one question you're going to ask your doctor or pharmacist the next time you see them? How are you going to take a more active role in your own health? Something to think about. Thanks so much for joining us on The Explainer.